The history of placebo and some of its early experiments. The definition of placebo from the medical perspective. The placebo effect is much related to the psychological effect, clearly imposing brain power over our bodies. This occurs when a patient is under the illusion of getting a treatment, while in fact he or she is receiving no treatment at all. Somehow patients feel better as they receive the fake treatment, and at times they even get cured completely. An example where placebo was used. In 1980, a doctor injected his patient with salt water instead of morphine, and she recovered perfectly well. The placebo effect has been addressed by many scientists, researchers, and doctors who all received the same results to a certain extent, especially in the field of relieving pain. Another example of a doctor using the placebo effect is Dr. Theodore Culture, who performed 1,600 neck operations without anesthesia in the 1890s. He performed this on conscious patients. You might be tougher than you think. Mitchell, in the early 20th century, performed full amputations and mastectomies without anesthesia. In ethical studies, you should not be leaving the ill patients untreated because of your interest in the placebo effect. But you can compare one placebo with another. 4 sugar pills are more effective than 2. Cyclosporin. It's widely used in transplantation and for immunomodulation in autoimmune diseases. It may have a role in minimizing myocardial reperfusion injury through its actions on the mitochondrial inner membrane pore complex. Is it ethical? The nocebo effect is one argument about this topic of ethics. The MMR vaccine has become to be known as the media's MMR hoax because of that some concerning findings about it proved it leads to autism for children. The media accused the wrong group of people for it. Colors have an impact on results.
Capsules give better results than pills. When patients get firm diagnosis, they are more likely to recover faster. For example, Dr. Thomas in 1987 gave a group of patients firm diagnosis and another group of patients uncertain diagnosis. 64% of the first group got better within the 2 weeks and only 39% got better from the second group. Doctors are always trusted by patients, so if doctors tell patients they'll get better and give them a placebo pill, patients will get better. It's because of the positive influence doctors have on patients. Dr. Stuart Wolf took the placebo effect to the limit. He had 2 patients that were suffering from nausea and vomiting and treated them with a drug that induced the nausea and vomiting, but told them that they will feel better. Surprisingly, they did feel better. The placebo effect can be connected to the theory of Pavlov's dog. The immune system can react to certain drinks if treated with a certain medicine repeatedly, the same way the dog reacted to the bell. So after many times, the immune system can react when given only the drink without the medicine. When not undermining the public health campaigns and leaving patients exposed to fatal diseases, homeopaths who are not medically qualified can miss fatal diagnoses or purposely disregard them, like telling their patients not to use inhalers or to throw away their heart. While there may be a role for an ethical placebo and homeopaths, but this demonstrated that they are not professional to provide it. In the end, we must enhance treatments which really work better than placebo to improve healthcare. Of course, without misleading people.